Atrial fibrillation is a fast, irregular rhythm which is generated in the top chambers of the heart. Now, the cause of that is the aging of the atrial tissue, particularly in the left side of the heart. So in the left atrium, this is a collecting chamber where the blood comes via the veins from the lungs into the heart. And it's at that point where the veins go into the heart where that tissue can become particularly irritable. Things that cause that are the fibrosis that happens with aging, alcohol, high blood pressure. Basically, getting older will cause this in people. So it's an extremely common heart rhythm problem. Those little veins, the tissue, as it gets fibrosed, can start firing off extra beats. And those extra beats can interact with one another and self-perpetuate further abnormal heart rhythms. And that is atrial fibrillation. The lack of coordination in the top chamber means that blood can pool and collect and itself cause the problem of strokes and blood clots with atrial fibrillation. And the fact that now the heart isn't in a coordinated fashion gives rise to the other symptoms such as shortness of breath, palpitations and tiredness. So there are many treatment options for atrial fibrillation or AF. The first thing to do is to prevent strokes. And the new blood thinner medication, which is really suitable for most of our patients, works terrifically well for that. Many patients also require treatment of their atrial fibrillation to put them back into the normal heart rhythm. And that can be either a catheter ablation, which is a small day case procedure which gets rid of the abnormal tissue firing off and causing the atrial fibrillation, or we can do a temporizing measure, which is called a cardioversion, where we give the heart essentially a shock under an anesthetic to reset the heart rhythm. Some patients eventually require a pacemaker, which would not actually treat the atrial fibrillation itself, but would regularize the heart rhythm and make people feel better. And in fact, some people don't really need any of these procedures at all and can make do with medication.